I'm Dr. Byrd. I'm a psychiatrist. We've got a clinic over in Professional Building 1, Turning Point Mental Health Clinic. This is my PA, Mary. And we're going to talk about burnout today. As a topic I'm not quite sure how much you know about, but we'll tell you what we know, and we'll tell you what we know works and what our recommendations are. We're going to try to leave a good bit of time for questions. Feel free to ask any question. No question is dumb. This is a confusing topic, and if you don't have questions, I'd be more concerned.
Hello, I'm Mary. It's nice to be with y'all today. So burnout originates from a disorder of energy metabolism, and I'm not talking about the Krebs cycle. A common metaphor for burnout is the battery. People will often discuss exhaustion and burnout as a state of, my batteries are just run down. This battery metaphor is at odds with reality. When a toy's battery runs out, what does the toy do? It stops working. When did you ever stop working? The answer is likely never, unless you're taking a leave for a significant life stressor, such as having a baby or a loss of a loved one, and that your energy stores are also going to be utilized during this time. This can result in an emotional condition marked by tiredness, distancing, and cynicism towards your job, a loss of interest or frustration that interferes with your job performance as a result of prolonged stress. A more useful metaphor for burnout, I believe, is energy, an energy account. Like a bank account, it can have a positive or negative balance. You withdraw energy from this account for the activities of your life and practicing medicine. You deposit energy into this account during times of rest and rebalance. When you dip into a negative balance, the account does not get closed. You keep spending or working despite the fact that your energy account is depleted. Burnout in the workforce manifests as an emotional condition marked by three main symptoms, which correspond with the three energy accounts. The first is exhaustion. This is when the physical and emotional energy levels are extremely low and in a downward spiral. A common thought process at this point is, I'm not sure how much longer I can keep going like this. Depersonalization. This is signaled by cynicism, sarcasm, and the need to vent to your patients or about your job. This is called as compassion fatigue. At this point, you're not feeling empathetic towards your patients. You feel depersonalized and kind of separate from them. They could be talking to you about their life, crying, tearful, and you could be sitting on the other side feeling just blank, flat. Another one is lack of efficacy. This is whenever you begin to doubt the quality and meaning of your work and that you don't feel fulfilled by your work duties and obligations at this point. At this point, you're asking things like, my work doesn't even serve a purpose at this point, or what's the use of this? You may worry at this point that you will begin making mistakes at your work and with your duties. Some of the physical signs of burnout include feeling tired or drained most of the time. You will have physical signs, behavioral signs, and emotional signs during this time. It could manifest as lower immunity or feeling sick more often, frequent headaches, back pain, or muscle aches, or change in appetite or sleep habits. Behavioral signs include withdrawing from other personal responsibilities, noticing that you're not running your errands as much as you were, or you're not on top of your game or paying your bills just on time like you should, just because you feel so depleted at the end of the day. Another point is using alcohol or drugs more often, or beginning to use them at all if you didn't previously. These are short-term quick fixes. However, they are depressants, and your stress will not go away by having a drink. What causes burnout? Burnout can result in a feeling of little control, having little control over your workplace or not being able to make decisions about your schedule or workload can lead to burnout. Being unsure about your expectations. At this point, we're at a time where hospital policies are kind of changing or flux, and your duties may be different one day than the next, especially among COVID, and communicating with patients and not having as many guests as usual. It can make communication a little fuzzy or gray or just not a major change than what it used to be. Another one is inadequate reward or not feeling appreciated in your work. Not being told thank you for staying late or thank you for seeing this extra patient. I mean, just showing signs of gratitude towards your employees, fellow workers, can go a really long way. Another one is perceived lack of fairness. If one employee doesn't feel that they are being treated as fair or as equally as others, that can also result in issues. And the last one is the conflict of values. In terms of how common burnout is, it happens all the time, it happens to all of us, and I want to let you know that you're not alone in this. As much as 44% of U.S. clinicians report burnout according to Medscape. 1 out of 3 nurses experience symptoms of burnout and extreme PTSD, and the highest is among our EMS providers, which signs in at 60% of these providers who are feeling symptoms of burnout. Beyond burnout, 39% of physicians report depression, and 400 physicians die each year by suicide, which is twice the rate of the general population. Now, we've talked about how you're not alone in these feelings and that we are here for you. Dr. Byrd's going to talk to you and address what we can do. Thanks.
All right, I'm Dr. Byrd. So does anyone have any questions about burnout or identifying it or differentiating it? Before we start talking about what to do with it, let's make sure we're on the same page about what it is. No? All right, fair enough. So you're going to work, you're finding yourself in a downward spiral, you're running out of energy, you're fatigued, you're not really enjoying work anymore. You think it's an energy situation. You say, I'm going to go to bed early tonight, I'm going to drink some coffee in the morning, and that just doesn't seem to help. At some point, be willing to consider the possibility of burnout. If you identify the problem, then you have a chance of doing something about it. A job becomes less and less fun when you're less and less effective. You're less and less effective when you don't enjoy your job. And so one bad thing begets another, and we end up snowballing. And the idea is to catch it as early as possible. The things that are going to interfere with you identifying this as soon as possible is going to be primarily, what are other people going to think about this? Are they going to think that I'm weak, that I'm not able to handle the situation? Is this something that I'm willing to admit to myself, and will I judge myself for this? And that mindset is one of the first roadblocks I think it's important to address. The idea is to be as effective as a provider as you can be, and that doesn't mean just as a healthcare provider, but any contact that you have with a patient where you can offer some sort of reassurance and just perform your job with some sort of meaning is important, that you stay vigilant to anything that could mess up that. And so what we know is we tend to start each job with a kind of a goal, an idea of where we want to go, and it's very clear, and we're very excited about it. Somewhere along the way we lose our focus, and that is normal for anyone. If you haven't had that happen, it will happen, or it happened and you're just not aware of it, and we're happy to help you out with that. But at some point you need to be willing to reassess whether you have lost your focus, have become unmotivated, and are willing to do something about it. When you decide to do something about it, that's one of the biggest decisions that you have. It's a relatively easy fix, or it's a relatively simple fix. It may not be easy, but the simple fix is changing the perception of what you're doing. If your job is stacking papers, that's a very important job somewhere in the scheme of things. But you don't want to be defined by what you do or what your job is. If your job is all that you do, then there's not a whole lot of reason to get excited about that. How does that fit into the bigger picture? Is there any way that you could be effective some other way that is meaningful to you? Can I be nice to the people that I see? Can I offer reassurance to someone that I see? Can I tell the people that I work with, you're doing a great job? What am I doing that is meaningful for me? And regardless of what they're paying me to do, what can I add in, or can I do this in a way that I've chosen as a meaningful purpose for my life? These are relatively vague questions. They're best kind of when you're allowing yourself to ponder them. But it really comes down to, am I able to be honest with myself? Am I able to be honest with my superiors? Am I able to be honest with my employees? And can I admit where my faults are, my weaknesses are? Whether there is any obvious answer to the headache, having the headache, and being open to what the headache may tell you is where the treatment starts. You can talk with family, you can talk with friends. We have counselors. We have our psychiatric office over here. We've got reduced copays. You don't have to have a psychiatric diagnosis to come see us. The idea is to stay on top of your game and not to wait until your life situation has fallen apart to where you're begrudgingly dragged into a treatment situation. That idea of taking control of the situation is one of the, like Mary said, is one of the most fundamental parts that keeps us from burnout, that we have an idea of control over our lives, that we have something to say about what we're doing. It's something as simple as asking your manager, could we tweak it this way? I think it might be more effective. That you're thinking about the big picture, and you can start getting more and more motivated because you're seeing how we're helping people. Can you help one another? If you help one another, you end up getting a boost yourself. You feel more effective, and it will also be repaid to you. And a good attitude and determination, and also empathy and willing to see when our other coworkers are in danger of spiraling down, that is our opportunity to intervene and just offer an ear, any advice they need, or any recommendations you may have. And if that requires sharing some of your own weaknesses or somewhere you're struggling, to invite them to do the same, I encourage you to do that. The other things that are relatively obvious but nonetheless neglected are our own health. So is there a reason that you're not sleeping well at night? Is there something going on at home? Is there something else that's draining your energy that you're spending more time thinking about? Address that. Don't pretend it's not there and assume that it'll just fix itself. We're here to help. We have an employee assistance program. We also have our psychiatric office, and we have another office. Just reach out for help. That's what we're here for. Our goal is to be as effective as possible, but unfortunately, good and bad attitudes are as contagious as COVID, and so we really have to stay proactive to ensure that the culture is not one of toxicity. And each of us has our own role to play in that. And I encourage you to reach out if you find that you're adding to the negative side of things. The first option is just simply addressing, bringing it to their attention. And it's never good to be accusatory, and it's never good to be pointing fingers. One of the best ways you can do it is just acknowledging how well they've done in the past, juxtaposed with recently. I'm seeing some things that are not on par with that, and from an area of concern, is there something I can do to help you with that? So we're reinforcing the fact that they are a valued part of the team, and that we genuinely are concerned about what's going on with them, and it looks from out here that something is going on, and encourage them to share that with you. And they have the opportunity to share that with you, or to say, everything's fine. And then you can say, well, we have these, I respect your autonomy, but we have these services available. And I really hope that whatever's going on isn't, or kind of passes. And keep that door open for when they are ready to come talk. And a lot of that is mirroring as well, taking the initiative of saying, I'm having a hard time with this, and this is kind of how I'm implementing that. Are you having any similar issues? But showing that kind of leadership of being vulnerable and inviting them to do the same. And also showing them the potential that you do see in them, and be as genuine as you can with that, about why it's bothering you that you're seeing them go that way, how much potential they do have, and that alone can kind of encourage them to the point that kind of a pep talk, if you will, but to give enough energy to say, you know what, I am going to address this. So that's a really good question. That identifying burnout can be complicated, because some days you have days that are better than others. The general trend of burnout is that it is indeed a negative trend, that one bad thing begets another, and things seem to snowball, and we're getting faster and faster as far as things kind of getting out of control. The sooner that we intervene, the sooner we can turn the curve around. But kind of identifying that ourselves would be, from a scientific method, is what is the evidence? And the evidence, when you're dealing with your own kind of symptoms, we like to think that we know what's going on, but we really have to trust what other people around us that care about us are telling us, and assume that they may have a perspective that we don't have. So constantly staying vigilant, not only to, am I at some sort of threshold where I need to go get help, but kind of just, where am I today? And if I am there, why am I there? And is there something I can do to address it? And if I can't address it, then I can go to someone else and then kind of go down the line, but constantly being vigilant for really one of the most insidious things that can really take away from your own health, and also take away from your productivity at work. So not treating it as an isolated issue, but on a spectrum of, when things start becoming frustrating, how am I dealing with this? How am I coping with this? And can I stay on top of that instead of getting behind? And being willing to reach out and just ask for some potential other tips. And here's the other thing that we know is, be willing to try something different. What we end up doing is doing the same thing over and over and over, and it doesn't work, and we say, you know what I'm going to do? I'm going to drink some coffee. I'm going to drink a Red Bull, and I got this. And then we're more exhausted the next day. And we're very intelligent people, but we say, you know what? But a Red Bull and a cup of coffee would treat this, and we're more exhausted the next day. At some point, you say, I don't feel overwhelmed, but you also have to be, willing to consider, if what you're doing is not working, are you willing to reconsider the problem? And you don't have to completely believe me or buy into it, but just be willing to try something that you haven't already tried. And if it doesn't work, you're happy to come and tell me everything that you dislike about it, your frustrations, because then we'll be starting somewhere. But identifying it and encouraging others to do the same is really what we're looking for. So to answer the question succinctly, is constant monitoring and being willing to reach out for help if you see a negative trend. When we say specific, it's not as obvious as something like a particular rash, obviously, but it's the overall trend. And you try to look to see, does anything else make sense? And am I frustrated at work? Am I having less and less energy? Am I more and more negative about my work? Am I more and more cynical about my work? Do I really not want to come to work? Those things compound on one another in the way that is there an issue that if I'm really mad at work today, is there something that's happened recently that's more obvious, like something at home that my mind's kind of still at that I could address, and I shouldn't be as worried that it's going to be a big trend? However, if there's nothing obvious jumping out at me that has happened recently, then I start to kind of think more and more about the insidiousness of my own attitude about what I'm doing and what I think about what I'm doing. So the trend and also the lack of any other rational explanation, and that would also be making sure that medically there's no cause for that as well. So the ongoing negativity and exhaustion without any other identifiable cause would be the. So there's a difference between getting by, and there's a difference between that and improving. So under stress, we find all of our little issues, our little areas that we could improve and are ongoing issues for us that we didn't notice before because we could cope with. Well, when we have an additional stressor, we can no longer cope quite as well. So this identifies that for us and gives us the opportunity to go ahead and address some of those things. So the symptoms of burnout are one of the best messages of areas to look at that you've maybe been avoiding, and also kind of reconsidering where are you, what is the big picture, where are your values, what's the big goal. If the answer scares you, what you might find is that you've lost any direction in life. If you find that you're afraid if you do think about these things honestly, that you may stumble across a depressive thought you'll never get out of your head. I can assure you that that fear is common. Everyone has an idea of I better not look in the sun because I don't know if I'm going to like what I find there. It's too painful. I don't want to look into it. It doesn't make the symptoms go away, but you can't have resolution for any problems that you're not willing to face, address, and call as they are. And we have medications, we have therapy, we have counseling. This is not start a downward spiral for you because you've addressed some aspect of your life that you've been avoiding. I would be excited that this is an opportunity to advance from that. So whenever COVID and all the stresses pass, all of a sudden we have so much more bandwidth, and we are now stronger from the experience instead of simply have gotten through and now our blood pressure is higher and have gained no meaningful benefit from it. So this truly is an opportunity, but you have to visualize it as such and also be willing to go through the issue of kind of facing whatever unpleasant things may come up, but it's a worthwhile headache to have. There's a concept of flow. This is the same general concept as the zone in sports, what they call it, but it's a place where you are that you are totally immersed in what you're doing and no outside distractions matter to you. And people will tell you that they perform very well. It's one of the most joyous kind of situations you can be in. It's just satisfying. And what we believe to cause that state of flow is when perceived ability matches the difficulty of the task at hand, and that the task at hand, if completed, is going to be meaningful to you in some way. So If your job itself is not meaningful for you, can we alter the idea of what is your job? Can we redefine your job? Can we change your job? These are all worthwhile questions. If that's the case, are you underwhelmed? Are you bored at work? Don't be scared to add on to that, to go out of your way to do something that you find to be meaningful to others. Because a lot of times that you would think that would exhaust you, but it seems to give you energy in some strange way. But what it's really giving you is purpose. And purpose unlocks a lot of energy that you didn't think that you had. So that state of flow, if you try to get into that, you say, what are my skills? What do I find meaningful? And how can I apply that in the best way? And usually it's better to have somebody to talk about that with. And that's family, that's friends, that's counselors. We're always here for you. And we also keep our documentation very private. We do not put drama in notes. It's very cut and dry, and it's also under an additional confidentiality. It's written as a confidential note, so only providers have access to it. And even if someone did get access to it, it would be a very blank, there wouldn't be much meaning there, and they wouldn't make much out of it. It's none of their business. If you choose to share it with them, that's up to you. But you retain the security of your information. And I would commend you on taking the steps to better yourself and to really address some of these things. And I would encourage you to share it with others, but you don't have to. But that would encourage other people to do the same. We are all afflicted by the same human condition. And so, surprisingly, none of us are perfect. And as soon as we admit the areas where we're not, we can start working on those and encourage others to do the same. That being said, we're always here for you. We've got our information on the packet. We've got a reduced copay. We also have an employee assistance program. We can always point you somewhere else if you prefer go somewhere else. But I'm genuinely honored to really be on your guys' team, and I would hope that you would please reach out and let me know how I can help you guys. And this is an area where I encourage everyone. We are all very intelligent people. However, when it comes to emotions, we tend to not think very logically. And so what I would encourage you to do is consider what getting help would mean. What would others think of me? And you say, why would someone else judge me for kind of improving myself? And you say, well, it's probably, there's lots of reasons for that. But the biggest one is, are they upset that they can't do the same? But as far as does it make you weak, does it make you strong? I can tell you personally that when someone is willing to openly share their weakness and their genuine hope to get over that is one of the most impressive things and shows the most confidence that I've have ever seen, and that's one of the most impressive qualities I can see in someone. And most people that I've spoke with share the same kind of sentiment. So if I was to say anything to convince you about that it's not a weakness, I would ask you what is the intention? What's more important to you? Is the more important part that you're going to be an effective team member and that you're going to keep your work life at work and not take things out on your family, or and kind of be a more stable person for everyone around you? Or would you rather people assume that you have these strengths and bottle those things up inside? And are you more concerned about the advertising or the product itself? And so if you're more concerned about the product itself, I think then you have to be willing to stand alone and say that you're going to seek help and really be the best that you can be. And if you're concerned about the advertising as far as the perception of how strong or weak you are, then I would encourage you to reconsider. when we were talking about logic and how we don't tend to use that in our emotional lives, the question of should I go see help or not, it simply doesn't make sense if you say that I'm unhappy with what I'm doing, I feel very confused, I feel unsuccessful, and the other people around me don't seem to share that attitude, but that's how I feel on the inside. So should I talk to someone about that? No, I'm going to keep that and stuff that down here. I'm going to take that on my family a little bit. I'm going to be irritable. I'm going to kind of try to bring other people down to where I'm at. But it's very important to me that no one else see that side of me. I think everyone can agree that on the surface that doesn't make a whole lot of sense. So I'd encourage you to challenge that and allow yourself to be vulnerable enough to bring those things up and encourage others to do the same. Right now, COVID is one of the most difficult times that hopefully we will ever see, but this is also an opportunity for us to improve and also provide care for countless people who are frankly frightened, and each of us is frightened as well. We think, are we going to bring this home to our family? Am I doing the right thing? And there's never a great answer, but everyone's in the same problem together, and everyone's having very similar struggles. And so I would encourage you to reach out, even if you're not sure you need to, just to reach out. And that's what kind of we're here for. If I could summarize in one thought, it's simply be willing to face the idea that something is worth addressing. Be bold enough to take a step toward treating that, and then with the newfound energy, joy, and appreciation you have for your life and your job, pass that on to others.